Hey everyone, welcome back to the channel. My name is NB and I'm a third year MBBS student at a government medical college in Kerala. In this video, I'm going to show you my general surgery postings from wards to OT and everything in between. And I'll be speaking in Hindi, English and a little Malayalam because that's how my daily life goes here. My day starts by getting ready for the postings. Surgery postings means you have to be prepared. We have to carry so many things in our bag like OT scrub, OT chappals, mask and head cap. These OT chappals are only for the OT use. You cannot wear them outside. Rules are very strict here. And once everything is ready, let's head to the hospital. We get surgery postings in MCH and that is inside the campus itself. So it is just a 5-minute walk. In MCH, the OT complex is on the second floor. Before entering, we first come to the OT reception. Here we have to change our clothes because normal clothes are not allowed inside the OT. And after wearing scrub, we follow a zone system. First is green zone, then yellow zone and then red zone. Until green zone, we can't wear the OT chappals. These zones are particularly for the infection control and sterilization. We have OT postings twice a week. Wednesdays for major surgeries and Saturdays for minor procedures. Posting time is usually 8 am to 11 am. But today something unexpected happened. The patient became very anxious before OT and developed bradycardia. So sir took it immediately seriously and asked to call the next patient. So for some time the OT was completely empty. That's why I can show you inside the OT today. As a third year student, we don't assist in surgeries. Our role is to observe and learn. During the surgery, our teachers explain important topics, what procedure is being done, what are the related anatomies, and how to approach the case. This is where the theory starts making sense. After OT, we change back into our normal clothes and attend the lectures. Not all days are the OT days. Most of the time we go to wards, OPD and procedure room. In wards, we take history from the patients, ask about their disease, symptoms and complications and try to get the diagnosis. And this is where I have to speak in Malayalam. So patient note സംസാരിക്കാൻ വേണ്ടി ഞാൻ മലയാളം പഠിച്ചു. And what all questions I usually ask, I'll tell you in this video. നിങ്ങളുടെ പേര് എന്താണ്? എവിടെയാണ് വേദന? വയസ്സ് എത്രയായി? ജോലി എന്താണ്? കൈ കാണിക്കൂ, താഴെ നോക്കൂ. These are the basic ones. When doctors come for ward rounds, they help us making decision to get the diagnosis and explain the diagnosis, treatment and the complications. Some days as a rotation we are posted in OPD also. So usually we stand behind our professors and observe the patient consultation. In OPD you will feel like you are a junior doctor because sometimes you are right behind your HOD or the senior doctors. Procedure room is attached to the OPD. Here we observe dressing, wound cleaning, ulcer care and more. Sometimes we even get chance to assist, which feels really exciting. The patient flow is relatively high here, but they give us excellent clinical exposure. Honestly, learning by seeing and listening is much better than only theory reading. In between, sometimes we have lectures also. So lectures are usually taken in the demo room. By 11 am, our clinical postings end. Then we get around 15 minutes to reach the lecture hall. But this time is mainly for those students who are posted in OBG and pediatrics. Because for those postings, we have to go to DH, which is 10 to 5 minutes away. But those who are posted in MCH utilize this time to write assignments, revising topics, or sometimes eating snacks. After postings, we have lectures from 11:15 to 4 pm with a 45-minute lunch break. In those 45 minutes, we have to go hostel, have lunch and come back to the lecture hall on the time. So it feels very hectic. We don't even get time to rest. And lecture schedule vary day by day. For example, today's schedule is OBG, pediatrics, lunch break, and then general medicine and finally forensic medicine. In third year, we study more than 10 subjects, but exam going subjects are community medicine and forensic medicine. 4 o'clock we complete our college schedule. After coming to hostel, I changed and washed my face. Then I had some snacks and tea. And for some time I play games that increase my reaction time. Then studied forensic medicine because almost every lecture we get new topics for next day's mini viva. After this Saturday surgery postings, we planned to watch a movie. So we went out. We had Chinese food in South Indian style and South Indian food in South Indian style. Then walked up to theatre and finally I watched Dhurandhar movie. I was very excited because of this song. Then we took auto and came back to the hostel. That was a day in my life during surgery postings. If you enjoyed this video, subscribe to the channel and I'll see you in next video.